As patients, carers, members of the Philippine Alliance of Patient Organizations, we breathe disease and death every day.
It is a struggle on all fronts, physically, mentally, emotionally, spiritually, and financially.
It has its disappointments, but also high points, as we encountered kind, healing souls along the way. But just when we thought we had it tough, COVID-19 made our fears bigger and deeper.
We cannot afford another disease, nor can we afford to put up a fight on all fronts. This is not our fear alone. Never in the history of mankind that there has been a disease that destroyed and disrupted so many lives and hope all over the world.
The COVID-19 vaccine is offering us hope. It is not perfect, but at this moment, it is our best chance to stop living in fear and to start living in hope.
This will not work if only a few of us chose to be vaccinated. All of us need to get the vaccine because no one is safe until everyone is safe.
PAPO stands solidly with experts and advocates for COVID-19 vaccine. We invite you to join this call of unity as we launch Bakuna Now Na to address the infodemic and help increase vaccine acceptance.
Never in our history has there been a more urgent call to stand united, get vaccinated, so together we can overcome COVID-19.
Bakuna, now na! Bakuna, now na!
Bakuna, now na!
Bakuna! Now na!
Bakuna! Now na!
Bakuna! Now na!
Bakuna Now Na!
Bakuna! Now na!
Bakuna, now na!
When it comes to how many kids Filipino couples want to have and how many kids they end up having, meron tayong nakikitang pattern. Parents usually end up with one child more than what they initially wanted. At ang pinakamahihirap na pamilya, sumusobra pa sila ng dalawa. Pag mas malaki ang pamilya, mas lumalaki rin ang posibilidad na maging mahirap ang pamilya. Poverty leads to children growing up not reaching their full growth and productivity potential. Responsible parenthood and family planning is one of the 3 program components of the Philippine Population Management Program. Tugon ito sa pangangailangan para sa epektibong pagpaplano ng pamilya. RPFP has 3 goals: 0 unmet need for modern family planning, pataasin ang paggamit ng modern contraceptives to 65%,
at maiwasan ang di inaasahang pagbubuntis,
lalong-lalo na para sa mga mahihirap na kababaihan. Sa RPFP, matutulungan ang mga couples na ma-achieve ang tamang pag-aagot ng pagbubuntis at ang bilang ng gusto nilang maging anak na kayang bigyan ng maayos na tahanan at kinabukasan. May iigtingin ng kampanya para maipatupad ang Responsible Parenthood and Reproductive Health Law at Executive Order No. 12 sa mga lokal na pamahalaan. We'll use communication campaigns to promote responsible parenthood and family planning, natural man o artificial methods, upang tumaas ang demand para rito, especially among poor women and families. Ilalapit natin ang reproductive health services at contraceptive commodities sa mga mahihirap na komunidad para ma-access ng sino mang gustong magplano ng pamilya ang family planning method na hiyang sa kanila. With the Responsible Parenthood and Family Planning Program of the Philippine Population Management Program, we'll make sure that couples and individuals have the knowledge and support they need to start the family of their dreams. Empowering Filipino families.
Labanan ng COVID-19, ang kailangan natin ay tama at totoong impormasyon, hindi fake news. Huwag ka agad maniniwala sa nababasa at naririnig. Ang pagkalat ng mga maling paniniwala tungkol sa COVID-19 ay nagdudulot ng panik, takot at maling desisyon. Laging i-double check kung saan nanggaling ang nabasa o narinig. Maging mapanuri at i-share lamang ang tamang impormasyon. Sa wastong pag-iingat, ang virus hindi kakalat. COVID-19, kayang-kaya nating tapusin.
Patuloy pa rin ang laban natin sa COVID-19. And together, we can beat the solusyon.
B. Bawal walang mask.
I. Isanitize sa mga kamay. Iwas hawak sa mga bagay.
D. Kumistansya ng 1 metro.
A. Alamin ang totoong impormasyon tungkol sa COVID-19.
Protektahan natin ang sarili at mga mahal sa buhay.
BIDA. Be the solution sa COVID-19.
Magandang gabi po sa inyong lahat. Ito po ulit ang Alaga Health Live. Ako po si Doc Dexter Galban at nandito po tayo. Nagse-celebrate po tayo ng ating National Allergy Day this 2021. And of course, hindi mabubuo ang ating programa nang hindi natin kasama ang ating mga extra special medical specialists. And of course, to kick things off, let us introduce first and foremost our resident celebrity psychiatrist, none other than Dr. Joan Perez-Rifareal. Good evening, Doc.
Good evening, Dex. Good evening, Dr. Dex. And good evening sa lahat ng mga naka-tune in tonight. And Dr. Dex, thank you to Alaga team for inviting me once again. Truly, truly, I am really very grateful and excited ako kasi mag-a-ask din ako ng advice from our doctors then also tonight. Thank you for having me.
Thank you very much, Doc. And of course, we're actually giving you what you asked for because we noted na ang dami-daming tanong tungkol sa skincare. And since we're talking about skincare, napakaganda siguro no na meron tayo dalawang napakahusay na dermatologists. And to kick things off, we have joining us this evening, Dr. Kei Rebolledo. Good evening, Doc.
Hello, good evening. I'm so excited to be here and to answer your questions regarding skincare. So I'm very much ready to answer all your questions regarding whatever under the sun regarding the skin. So thank you, Alaga Health, for inviting me tonight.
Perfect. Thank you very much, Dr. Kei. And of course, joining him, another extra special dermatologist. We have the lovely, the beautiful Doc Iza Encarnacion.
Ayan. Hello, everyone. Hello, Doc Dexter, Doc Joan, and hi, Doc Kei. I'm Doc Iza, and I'm also ready to help Doc Kei answer your medical or derm questions.
Thank you, Doc Iza. And hindi mawawala siya kasi napaka-importante na sa ating buhay, no, na meron tayong mapupuntahan pagdating naman sa primary care. Joining us, of course, Alaga Health's resident primary care physician, none other than Dr. Roderos. Good evening, Doc.
Hi! Good evening po sa lahat ng ating mga viewers and of course to our lovely guests, no? Doc Joan, Doc Iza. Hi, Doc Iza. Doc Kei. Thank you for joining us. And this topic, yung pag-uusapan natin tonight, is personally very excited ako dito, no? Kasi it's all about taking care of our skin, no? And I'm sure our viewers and all our kaalagas are very much excited also to hear our special guests, no? Paano nga ba natin papangalagaan ng ating kutis, no? So, I am very excited. Thank you, Doc Dex and Alaga Health again for this segment.
Thank you, Doc Via. And dahil ito ay Alaga Health Live, hindi lang mga health professionals or medical professionals ang bida. Of course, kasama natin dito ang ating mga patient advocacy champions. And one of them is joining us this evening, no? And he's actually a very prominent member in the world of patient advocacy, particularly when it comes to a specific skin condition. And representing, of course, Psoriasis Philippines, none other than Mr. Paul Mendoza. Good evening, Sir Paul. Magandang gabi po.
Hello, good evening everyone. Thank you for inviting me here in Alaga Health. Thank you, Dr. Dex. And nice to meet po yung mga katulong natin sa pag-promote ng health awareness. Hello po mga doctors natin.
All right, thank you very much for joining us. As you can see, we have a wonderful panel tonight and we're giving extra emphasis on all of the consultations and the questions that you've posted dun man lang mismo sa ating mga publication materials. So, let's get to it. Maybe it's time for our Alaga Health Check-up. There you go. So, Alaga Health Check-up, what does that mean? Pag-usapan natin yung dahilan ng ating sineselebrate ngayong week. And that is, of course, National Allergy Day. Just to give us an idea, Doc Via, ano nga ba yung allergy? Kasi ang dami natin naririnig tungkol sa allergy. Meron daw yung allergy sa baga, allergy sa balat, at kung ano-ano klase ng allergy sa gamot. Ano nga ba yung allergy? Bigyan mo naman kami ng idea, Doc.
Alright, no? Again, no, this topic is very much exciting for me because you're not only talking about skin, no, but also about allergies as well. So, ano nga bang allergy? Ang dami nating kukuhang tanong, no, Doc Dex sa Alaga Health about what really is allergy. Yung allergy is our body's mechanism to respond to what we call allergens, no? Yung katawan natin ay mga nagre-release ng tinatawag natin na histamine, no? That would cause a lot of reaction in our body, kaya tayo nagkakaroon ng pangangati, ng pamumula, no? And that's the reason why when we have allergies, no, or when we encounter something that we are allergic to, kunyari, number one dyan, yung alikabok, no? We are very allergic to dust mites. We are also allergic to Sa mga kinakain din natin, some of us are very allergic to shellfish or seafood, di ba? Ang dami nating pasyente na, Doc, hindi ako pwede sa seafood. How can I, what do I do? How do I treat this? No, usually, we treat the symptoms, we treat the reaction, no? Kasi iniiwasan natin, first and foremost, yung discomfort. Kasi yung pangangati nga naman, because of the allergic reaction, can cause yung tinatawag nating urticaria or yung pangangati, no? Or, we also, yung pinakadelikado dyan, we want to prevent yung pag-close ng ating airway. Kasi minsan, some of the allergic reactions would also cause difficulty of breathing because nagko-close yung airway natin. So that's what we want to prevent, no? If we have allergic reactions, so what we would usually do is we give antihistamine, no? Yung mga cetirizine na binibigay natin. And a lot more medicine that can actually prevent, no, the aggravation of yung symptoms natin. And I'm very sure, no, dahil pinag-uusapan natin yung skin, yung pangangati, pamumula, no, most of that would be relating to our skin. And nako, very excited ako dito. Maybe our guest later can share some tips on how do we really take care of our skin. Kasi di ba, Doc Dex, and I'm sure marami sa ating naka-experience ito, minsan we have a lot of allergic reactions that can actually manifest for a long time in our skin. So paano nga ba? How do we prevent this? And how do we prevent scarring, kumbaga? And those questions will be answered later by our special guests, no?
Yan, perfect. Thank you for the brief intro regarding allergy. Kasi napakadaming misconceptions na kumakalat everywhere, lalo na pagdating sa allergy. Pero since ang medyo focus natin ngayong gabi ay dumarating sa tinatawag natin quote-unquote skin allergy o mga problema sa balat, tanungin natin ang ating mga nagagandahan at nagwagwapuhang mga dermatologists regarding ano nga ba yung mga biggest misconceptions kapag naririnig natin yung mga terms na skin allergy o yung mga common conditions na nararanasan ng mga ating mga viewers regarding their own skin. So maybe we can ask, unahin natin siguro si Doc Iza. Any thoughts po, Doc Iza?
Hi, yes, good evening again and hi everyone. Okay, so tama nga si Doc Dia about allergy. So ang daming causes pwede ng allergy, no? Pero specific to the skin, usually tawag natin tong allergic contact dermatitis or anything that comes in contact with our skin sometimes triggers the antihistamine na sinasabi ni Doc Dia, nagre-release ng histamines yung katawan natin. So, kunyari, nakahawak tayo ng coins, ng rubber, hindi natin alam allergic tayo, or hair dye, hindi natin alam ginagamit natin na bilhin natin, may component pala yung hair dye na yon, yung tinatawag natin na PPD or mahabang term yun pero yung component na yon usually nagkukos ng allergic reaction sa scalp natin, tas minsan napupunta sa mata natin, sa nape natin, dito sa bato. Sometimes din yung nail polish, pag kinamot natin yung mata natin, minsan kumakati na rin yung eyelid natin. So, allergic din yung tawag doon. Allergic ka rin din sa some component ng nail polish na yun. So, sobrang daming pwedeng maging cause ng allergy. So, kaya nga sabi ng Doc Dia, kahit food, kahit yung dust mite, anything in contact. Pero iba-iba yung test nun. So, kunyari sa food, meron tayong food testing para malaman natin kung saan tayo allergic. Sa dust mite or sa pollen, sa mga ganyang nalalanghap natin, meron tayong mga skin prick test na pwedeng gawin. Pero kung sa balat, usually sa mga nakahawakan natin, ang tinatawag naman doon ay patch testing. Yung nilalagyan natin ng allergens sa yung likod natin. Usually 30 allergens, if I'm not mistaken. Tapos titingnan natin kung saan tayo magre-react doon para malaman natin kung ano yung pwede nating iwasan. But, kung syempre, may budget tayo, hindi tayo basta nagpapatest-test, pwede tayong gumawa ng symptom diary o kaya lalagay natin doon kung anong oras lumabas yung kate-kate natin yung allergy, anong nahawakan natin, ano yung activity na ginawa natin, or yung food na kinain natin dahil marami yung magagawa ng diary na yon. So, pag nabuksan natin yung diary na yun, malalaman natin agad kung ano yung nag-trigger ng allergy at yun yung dapat nating iwasan. So, yun lang from my end.
Ayun, thank you very much, Doc Iza. No? So at least very clear. Ano yung mga possible triggers, no? From coins to rubber to so many things. 30 plus ang itetest para malaman kung ano yung nagiging trigger ng pangangate, pamumula, etc. Oh, ito, actually, may pumasok na tayong question. Ito from one of our publication posts, no? And ito na po, Ma'am Erlinda, ang hinihintay nyo. Ang tanong ni Ma'am Erlinda Sese, ang tanong niya, I have melasma. How to cure it? Siguro, Doc Kei, natin tanongin natin. Ano bang pwedeng gawin, Doc? Ano nga po nang bali yung melasma at ano yung pwedeng gawin ng mga viewers natin para mapaayos o kaya naman ay maibsan yung concern nila regarding melasma?
So actually, hi, I'm Doc Kei. So again, thank you for inviting me. So actually, melasma is not a form of allergy, no? Baka that's a misconception among our viewers. So it's not an allergy, it's a totally different entity. But anyway, since there's a question about it, so I'm glad to be answering about melasma. So melasma is very common here in the Philippines, no? Because malakas yung araw sa atin, di ba? So parang summer every day. So yun talaga yung number one trigger ng melasma, no? Which is sunlight. So it's very common here, lalo na po if hindi kayo mahilig gumamit ng sunblock, no? So dito kasi sa Philippines, parang hindi uso yung sunblock. Parang ang feeling ng mga tao, ang lagkit, ayokong ilagay, no? But my number one tip para gumanda yung skin nating lahat, no? Wear sunblock 365 days of the year. Kahit nasa loob ka lang ng bahay, kahit wala kang planong gawin, wear sunblock, no? Bakit? Kasi ito ang most proven anti-aging ingredient na meron, no? So you don't have to invest in yung mga mamahalin, mga collagen, ganon. You don't really have to do that, no? You just need to invest in a good sunblock kasi the sun's rays are very damaging, no? They cause damage to the DNA of the skin. So pagka araw-araw naaarawan ka, no? Nadadamage yung skin mo, kaya magkaka-wrinkles ka, no? Kahit yung mga ganitong ilaw, like ito, syempre meron akong ring light para maganda yung itsura, no? So kahit yung mga ganitong kasimpleng ilaw, it could actually cause mga darkening sa skin. Kaya uso din sa atin yung mga tinatawag nating sunspots or solar lentigo, no? So anyway, going back to melasma, yun nga, no? So it's usually caused by UV. Other known causes for melasma would be mga OCP, no? OCP, yun yung mga ginagamit na pills pang-control ng para hindi mabuntis, no? So anyway, yung mga yun yung mga most common causes. So to answer the question, paano ba mapapagaling ang melasma? The most simple answer would be to wear sunblock every day. So ayun.
Perfect. Thank you very much, Doc Kei. No, very comprehensive. Kita-kita nyo naman mga viewers natin, sobrang swerte natin kasi talagang comprehensive silang sumagot. Plus, we get to learn about some of the tips that we can apply in our lives. Kasi kalimitan ng mga Pilipino, pag sinabi nilang sunblock, ay no, kapag magsi-swimming lang o kaya kapag summertime, tapos magsi-sunblock sila. Like 1 or 2 minutes bago lumusong sa tubig. So parang halos wala din. So, with that being said, actually, buti na banggit ni Doc Kei yung concern about OCPs, kung bakit paminsan nagmamanifest siya, diba? Kasi we actually have a question here from Mr. Alfred Hoxon. Ang question niya is, totoo ba talaga na gamot ay pwedeng makapag-cause ng skin problems? I take mental health drugs po. So Doc Joan ito. Doc Joan, mga psych drugs, I think nire-relate daw niya simula ata na nag-take siya ng psychiatric drugs, nagkaroon siya ng parang pangangate or probably some skin manifestations. Anong thoughts niyo dito, Doc Joan?
Yeah, good evening again to everyone. Yung question kasi hindi na specify, no, Dr. Dex, kung ano yung
Yes,
specifically
Doc.
iniinom niya. So, in general, anyone naman po, no, hindi natin napipredict kung ano yung magiging reactions natin to any medication. So, depende pa rin sa biological makeup ng isang individual. So, let's remember always na in mental health, no, with regards to mental health and the skin, o di ba, meron din kasi tinatawag the mind and skin connection. So, it can happen po in three na paraan, three ways. So first is yung ating psychological or mental health will cause or will trigger because of the stress. For example, it will trigger a problem, no, like exacerbation, for example, na isang skin problem, skin disorder like yung acne, etc. So ito yung parang arrow from mental health to the skin problem, or baliktad. Yung ating skin problems naman can in fact make us feel stressed, no? Kaya pag minsan naman, di ba, pag may mga skin problems ay parang, nahiya akong lumabas ng bahay kasi medyo nagbe-breakout ako ngayon. May mga ganon, no? So it can also affect our mental state. And another is yung yung skin problems can be manifested in some forms of psychological or mental health concerns. For example, yung OCD, yung iba hugas ng hugas o nagda-dry skin, etc. But doon sa question specifically kung if it's a specific side effect, we cannot predict kasi, no? So pwedeng it can be na doon sa pang third siguro, no, na with as a secondary effect ng medications taken, but again difficult to predict kasi kung sino magde-develop. So meron lang specific na medications na very notorious, no, quote unquote, to have yung effects sa balat na yung nagkaka-scarring. So, I'm not sure kasi kung yun, it's a form of a mood stabilizer. So, baka ganon. Yun lang nga, sayang, hindi niya na-specify kung anong medication yun. So, usually, mood stabilizers, meron silang effect na ganon sa balat.
Ayun, thank you for that, Doc June. Kasi pwedeng maging cause of concern yun, one of the reasons kung bakit hindi nila iinumin yung kanilang medications for their mental health. So, it's good na nakikita natin na meron talagang expected reactions yung iba, o kaya naman, I think it would be good if they will tell their psychiatrist or their medical doctor kung ano yung kanilang nararamdaman para if ever there would be a need to shift or change or probably guide them through it, that would be wonderful. And of course, hindi natin makakalimutan kasi kaya nga siya nandito to champion patient advocacy pagdating naman sa tinatawag nating medical condition or skin condition na ang tinatawag nating psoriasis. From Psoriasis Philippines, nandito si Sir Paul Mendoza. And Sir Paul, it's a pleasure to have you with us. And ang una naming tanong is, sa mga hindi nakakaalam, ano nga ba, at least based on the very easy to understand way ng ating mga patient advocates, ano nga ba yung psoriasis, Sir Paul?
Yes, thank you, Doc Dex, for again inviting me. Yun, siguro just to give you a brief background about psoriasis. So, ang una niya kasing manifestation, lumalabas siya sa balat. So, para siyang mapula, tapos makaliskis, kumakapal. So, kumbaga, ang normal skin natin, 3 to 4 weeks bago nagpapalit yung skin cells natin normally. Pero when it comes to psoriasis naman, around 2 to 3 days, gawa siya ng balat, kaya nangangapal siya. Pero yun nga, as part of our advocacy, we are really fortunate then and blessed kasi we have a good relationship and partnership with Philippine Dermatological Society. And isa pa na pwede kong sabihin is that with the recent studies kasi, yung for the longest time kasi kala nila sakit sa balat lang ang psoriasis. Pero ang dami pa lang nangyayari sa loob ng ating katawan. So ngayon, ang psoriasis is considered na as a systemic inflammatory condition. Tapos yun nga, since panghabang buhay natin siya, talagang nakaka-frustrate and marami sa amin na de-depress. Kasi nga, di ba, pagdating sa balat, sa kultura natin, ang premium na binibigay sa balat, di ba, dapat flawless ka, dapat maputi ka. Pag may peklat ka or may marks ka, sometimes parang talagang hindi natin maalis na nahihiya tayo or we feel down. Pero yun, just want to encourage na it's okay lang. Kung baga, the way you look does not define who you are, di ba? Pero kung ano talaga yung sa puso mo, ano yung kakayahan mo, yun yung doon ka mag-concentrate.
Yon. Ang ganda namang marinig nun. Thank you for that, Sir Paul. As you can see, we here in Alaga Health value partnership pagting sa ating mga pasyente as well as our health professionals. And that's why Sir Paul Mendoza is here. So probably very quickly, any tips from Doc Kei and Doc Iza regarding how to best manage psoriasis, especially sa mga viewers natin. I believe this is also streaming live sa Psoriasis Philippines. So, any quick tips and tricks siguro to better manage Doc Kei and Doc Iza regarding psoriasis?
Who goes first?
Sige, Doc Iza na lang.
Iza, go ahead.
Thank you. Okay. Hi sa mga nanonood galing sa Sorfil. Hi, Sir Paul Mendoza. Napaka malapit sa amin lahat ng mga psoriasis patients sa East Ave, sa Jose Reyes, sa lahat ng mga institutions na nag-aalaga sa ating mga Sorfil patients. Sobrang love namin sila. Maraming manifestations actually yung psoriasis, pero kadalasan nakikita yun sa balat agad. So yun yung una nating napapansin, yung parang matagal na sa balat na nangangapal nga, katulad ng sinasabi ni Sir Paul, na may scales. Tapos, kadalasan hindi natin alam kung ano ito, iba-ibang gamot yung ina-apply natin, hindi tayo nagpapacheck agad, kaya, pero hindi siya gumagaling, okay? So, number one, dapat magpa-check muna tayo sa board-certified dermatologist para masiguro natin kung ano ba yung tinitreat natin. Hindi yung lagay lang tayo ng lagay ng kung ano-anong gamot kasi pwede rin siya mag-cause ng allergy. So, mas mabuti nang makita natin sila tapos ma-address. So, depende kasi yan. Kung balat lang, kamukha ng sinasabi Sir Paul, hindi lang kasi siya sa balat, no? Multisystemic siya, heterogeneous siya, nakaka-apekto siya sa puso. Kadalasan yung mga merong BMI or body mass index na nasa heavy side, usually sila yung at risk sa mga cardiovascular or mga sakit sa puso. Nakikita rin to sa mga kuko, nakikita rin to sa mga joints, kaya kailangan din ng referral to rheumatologist para mas matulungan yung mga patients natin to. At usually, sana hindi, pero merong chance na sa balat, mag-manifest din mula sa balat, ma-affect din yung ating joints. Kaya dapat mapigilan yung progression nito. Tsaka yung progression nito sa sakit sa puso. So, usually, step-by-step approach siya. Kadalasan nag-uumpisa siya sa pahid lang, pero minsan pwede tayong magpailaw or phototherapy. Minsan may iniinom tayong mga gamot. So, yun lang. Kailangan yung dermatologist or yung rheumatologist yung magsabi sa'yo kung ano yung appropriate for you.
Yun. So, anything to add very quickly lang, Doc Kei?
Ayun. So, I agree with Doc Iza, no? Love na love namin yung mga sore patients namin. So, I'm very proud of them kasi yung community nila is very tight and very talaga sila, no? Very resilient. So, yun nga, gaya ng sabi nila, no? Yung psoriasis kasi kitang-kita, no? Unlike, for example, diabetes, high blood. Hindi mo naman nakikita yon. Yung psoriasis, pag nakita mo kasi, agad, no? Very striking. Kaya yung mga patients, when they come to us, they feel depressed, they feel ashamed. So, aside from the medications, no, we really give them counseling para they gain their sense of self-confidence back, no? But naalala ko lang, nung resident ako when I was still training in Jose Reyes, meron akong naging psoriasis patient na parang bumibili siya ng mga parang products na uso sa mga pyramid scheme, no? So, I just want to warn yung mga nanonood na merong psoriasis, no? Magpakonsulta na lang po kayo sa board-certified dermatologist kasi yung kwento niya sa akin, no, ang dami-dami na niyang nabili, ang dami na niyang nagastos para sa pills na hindi ko rin naman alam kung ano yung laman. No? So, yun talaga yung first step, magpakonsulta para ma-diagnose yung psoriasis. And aside from that, very practical tips for those who have psoriasis: avoid smoking, no? Kasi smoking is one of the known exacerbating, meaning nagpapalala ng psoriasis, no? So avoid smoking, and also keep your weight at a healthy level, no? Kasi obesity is another thing that could trigger or exacerbate psoriasis. So for the specific drugs kasi, no, it would be better to discuss it na lang with your dermatologist. Pero yung mga practical tips, yun yung mabibigay ko tonight, no, for our viewers. Ayun lang.
Perfect.
Thank you. Thank you.
Thank you, Doc Kei. Actually, pumapasok pa yung mga questions natin ngayong gabi, and it looks like paganda ng usapan. But before that, no, let's take a very quick detour so that we can have a short but hopefully very exciting Alaga Health update. Yeah. And that was the quick ad for our Alaga Health platform. And actually, ang maganda is in exactly 1 week, all of you who are watching this live stream right now, magkakaroon na ng access to the Alaga Health platform. And if you're having a wonderful time, especially to our long-term viewers, and you want to possibly book services with Doc Joan or probably Doc Kei or probably Doc Iza, and even to all of our friends sa Sorfil that they would like to get access to dermatologists or other health professionals, you can actually get hold of them or probably reach them through the Alaga Health platform. At sobrang dali lang po talagang mag-register. For example, pakita ko sa inyo ngayon, no? So, if you're going to look right now, this is actually the browser that you probably have at home. So if you're gonna go to the Alaga Health website, yan may maganda pa siyang animation. And you're going to see Alaga Health is the Philippines' first digital marketplace and health service hub. The App Store, Google Play, and website regarding why Alaga Health is doing this and all of the ways that we can work with you. As you can see, na-feature na po tayo across the board, even WHO, ECOSOC, among many others, and of course, our partners here below. But what I actually want to show you tonight ay ito. Kunyari gusto mong mag-book yung service, for example, nila Doc Joan, nila Doc Kei, nila Doc Iza, you can actually go here sa sign up. And for example, you're a patient. Kumbaga, you're watching this video right now at talagang gusto mo magtanong tungkol your condition, all you would have to do would be to click that sign-up form or even go to www.alagahealth.com/registration.html. Then you will end up going to this part of the website, and all you have to do is select, no? If you're a patient, click this. If you're a partner, meaning health professional ka, and you want to become part of the Alaga Health family, ang maganda dito, you get to keep your own branding, you get to keep the name and the way that you would like to team up with your patient. And if you're a clinic, pwede din. Kumbaga, you're doing group practice among many others, pwede ka ding mag-register. So for example, clinic mo yung patient app because you're a patient and you want to reach our health professionals. So very quick lang, just scroll through and then just, of course, you have to read. Very important, data privacy tayo. So read very carefully and then click continue. And then what will happen is you will end up going to this part of the website and you can just have to fill up your application form. Actually, the application registration form. Fill up your details and poof, you're ready to go. At ganun lang po siya kadali. And even for health professionals, same thing. And it would be very easy for you to now have access to your health professionals, your preferred health professionals, anytime, anywhere, every way. So pwede yan ng telehealth, pwede yung home visit, pwedeng clinic appointment, anytime, anywhere, every way. So that is Alaga Health. And speaking of healthcare, since we were talking about this a while ago, di ba? Kasi nabanggit ni Doc Kei na minsan nakakaroon ng impact daw sa well-being or sa perception ng ating mga patients with psoriasis, yung kanilang mental health na nakaka-affect. So maybe we can ask Doc Joan, any tips po, Doc Joan, when it comes to managing mental health, particularly now that there is a premium, kagaya ng nabanggit ni Sir Paul kanina, na pagdating sa skin, it affects your perception of yourself. Paano pag meron kang condition that makes it a little bit more difficult to achieve your quote-unquote ideal skin or probably ideal image, kumbaga, when it comes to dealing with the public. So any thoughts, Doc Jo?
Yes, thank you. In fact, in general na lang siguro, no, Dr. Dex, across all forms ng skin disorders or skin problems, it's really very important po tandaan natin na we are not defined by our skin. OMG, it's beyond that. Na? So it's not really all about the skin. So let's remember na we are beyond our skin and focus tayo doon sa ating mga i-highlight natin kung ano yung mga good qualities natin, like our skills, our capacity, ang ano natin, no? Kung may magandang feature tayo, doon natin mas i-highlight and not really to focus on the mga negatives or the mga scars, etc. And of course, maganda rin yun, no, na kung meron tayong mga, yung na-mention ni Sir Paul kanina, na symptoms of or feelings of being sad, embarrassed, or being ashamed not to go out dahil sa mga skin lesions, always remember also, number 2 is to acknowledge it. No? Maganda rin na i-acknowledge din natin yon kasi nga from there, with that acknowledgement ngayon, then we are able to move forward and siguro yun na nga, focus on the positive aspects, no, ng ating personality, ng ating personhood. And also, number 3 is maganda din also to talk to someone kasi we know na we are never alone. In fact, studies have shown na hindi naman, in fact, significant yung sa psoriasis, di ba, Sir Paul? It's about 2 to 4%, no, of the population. So, madami yun. No? So, we are never alone in this journey natin. Kung nagkakaroon tayo ng mga flare-ups, exacerbations, always maganda po if you talk to someone about it, mas maganda pa rin. No? We express our emotions and talk about it, process it. Again, we are more than our skin lesions or skin conditions. Let us not be defined by our skin.
Yan, thank you for that, Doc Joan. And we actually have more questions coming in. I think, Doc Via, meron atang pumasok na question live from YouTube. All right. Okay, so I think nagkaroon ng connection problem si Doc Via. So, tingnan natin. Ito yung question from YouTube, from Miss Miriam Brule. Sana ma-avail ko po ang libreng konsulta. Patingin daw po yung binti niya. Kasi matagal na daw may iniinday, may sugat daw kasi siya, pabalik-balik, tapos hindi niya mapatignan sa derma. At wala daw siyang pera or wala din siyang work. So, any thoughts dito ating mga wonderful dermatologists? Kasi mukhang hindi nakapagpadala ng picture si Ma'am Miriam. Typically, ang practice of dermatology, very, very visual. You have to see it para tamang-tama yung ating diagnosis. Pero given yung description niya, mga doc, ano po ang ating kayang pwedeng maibigay na tulong kay Ma'am Miriam? Siguro si Doc Kei naman ang maunahan.
Sige. So actually, all the training institutions ng PDS or the Philippine Dermatological Society, just follow their page on Facebook. They offer free teleconsult, no? So all the residents in the institutions, marami po yan, no? If I'm not mistaken, 13 na ngayon. They all offer free teleconsult, no? So, madali lang pong mag-book ng appointment. I can only speak kasi kung saan ako nanggaling, which is JR. You can visit their page and madali lang mag-book ng appointment and it's free, no? With regards dun sa sugat na hindi gumagaling, no? So, ang daming possibilities, no? So, sa utak ko, ang daming nagpa-pop. So, Siguro the first question would be, meron po ba kayong diabetes, no? So, yun po kasing may mga diabetes yung mga nagkakaroon ng mga sugat na hindi gumagaling, no? So, I think that's the first step would be to check the blood sugar of Ma'am Miriam. So, ayun po.
Yan, thank you, Doc Kei. So, anything to add, maybe Doc Via, Doc Iza, any thoughts po? Nabanggit yung diabetes. Any idea or anything that you would like to probably advise Ma'am Miriam regarding her condition? Doc Via,
I
as
think
primary care.
before Doc Iza, no, I'll give a very very quick response to that. Tama yung sinabi ni Doc Kei, no? We might have to check. Probably there's an underlying cause with that, no? And importante kasi na makita talaga yung sugat, no? Gaano siya kadalas bumabalik, no? Ano yung triggers niya? That is also something that we have to ask, no? Pwede nating itanong yun, no? Especially, kailangan kasi nating malaman kung saan nanggagaling or ano yung nagko-cause nito before natin siya maggamot. So it's important na wag po mahiyang magtanong sa ating mga doktor, especially sa ating mga board-certified dermatologists sa anumang kondisyon na meron tayo sa ating mga balat, no? So I think Doc Iza has something to say, no? Or I think may tips si Doc Iza, especially sa mga ganitong kondisyon.
Nasabi na actually ni Doc Kei and Cal, nasabi ko na rin lahat. Actually, better talaga magpakonsulta, nag-o-offer ng libreng consultation, lahat ng mga PDS na accredited institutions, sa Syrian East Avenue Medical Center, hanapin nyo lang sa Facebook nila at mag-book doon.
Thank you for that, Doc Iza. And what's wonderful is that Alaga Health is actually reaching out to our partner societies, our partner medical societies, kasi even if they will be offering these services for free, hopefully we can link them up to the Alaga platform so even more patients can access them easily. So, with that being said, as we mentioned before, Alaga Health Live will respond to any and all questions kahit hindi pa yun yung main topic natin. And buti na lang talaga, nandito si Doc Joan kasi we have quite a number of questions coming from our viewers regarding mental health. Ito, this one, sana po nanonood na kayo ngayong gabi. Sir Noy Mangalino, meron daw po ba na pwedeng mag-assist sa kanya na doktor? Kasi sobra daw siyang nade-depress. 11 years na daw po siyang depressed. And anak daw niya siya, 39 years old. Simula pa daw ng 2010. So, Sir Noy, sana po makatulong si Doc Joan, at least kung ano yung mga pwedeng gawing next steps, and pwede din siguro mag-assist si Doc Via. Pero anong thoughts nyo, Doc Joan, pagdating dito? Parang matagal na, 11 years. And
Oo, medyo matagal na.
Yes, Doc. Any thoughts?
Oo, medyo matagal na. So, yes, thank you very much po sa question. Medyo matagal na po siya. So, mas maganda po, no? We always look at it from a parang longitudinal kasi po, no, na aspect. So, ano po ang mga possible stressors po? Kasi when we know, pag nalalaman po natin kung ano yung mga possible po triggers or stressors for the symptoms of depression, mas maganda para ma-address po natin yung mga triggers or stressors po if we can address po, kung kayang ma-address. Number 2 po, mas maganda po i-monitor also kung ano po, no, meron ba kayong pwede pong kung saang area po kayo ngayon, kung baka po meron kayong pwedeng makausap about it, no, kahit po kung walang access sa any mental health professional, baka meron pong other ano po, no, possible po na members ng community na pwede niyo po munang makausap, and baka through referral system also. Then know po na help is always available, at usually po ang management for depression is, ang depression po, wag mawala ng pag-asa kasi it is highly treatable. May mga options po for treatment for the depression, and mataas po ang recovery rates. Kaya talaga pong it's maganda po, no, kung talagang mapatingnan kaagad, mapasuri para maagapan po kaagad at wag nang umabot po sa other forms of complications or other comorbidities. Again, it's highly treatable. Help is available po. Andito po kami to assist you po and help you through this.
Yan. Thank you very much, Doc Joan. And of course, tamang-tama yung sinabi niya that help is always here. Kaya nga ang Alaga Health, we want to provide healthcare anytime, anywhere, in every way. Kasi minsan, just finding the right information, finding the right doctor would be very difficult na kasi hindi nila alam kung saan pupunta. Pero hopefully to guide them, we'll be here every Saturday from 8 o'clock to 9 o'clock. Plus, pagdating sa health services, we have Alaga Health. But when it comes to medical information na validated ng ating health professionals, we actually have a partner for that. And maybe it's time for that time of the night. It's time for an Alaga Health na Alagang Hello Doctor. Okay, so it looks like we're having some technical difficulties, but no worries. No, what we will be doing is we will be plugging our partner for Alaga Health Live, and that is hellodoctor.com.ph. So let's do a quick check. Can we have our Alagang Hello Doctor right now? Yan. So, as I've said, no, if Alaga Health is to health services, we have a partner, and ang swerte ng Alaga Health because we're teamed up with hellodoctor.com.ph and the Philippine of the Hello Health group that is present in over 9 countries. Pagdating sa validated medical information, actually, I'll show you their website right now. Nako, friends po talaga namin ng hellodoctor.com.ph, no? And ang maganda, they even have a section, no, when it comes to skincare and cleansing. So sample tayo ng mga nabanggit kanina. Ito, very interesting kasi napapansin natin to palagi. Ang mga Pilipino gustong pumuti. Kaagad. So tingnan natin itong sample article na pwede nyo makita dito sa kanilang website. So when you click that, you can even see sino nagsulat and when. Glutathione whitening. Yan. What is glutathione? What does it make skin lighter? Is it safe for use? Yeah, and even goes through some of the issues and concerns and some of the possible alternatives to that. And ang maganda, you can always reach out to their expert panel of doctors that validated the content of this article. And we're very happy because you can even go to their main website, no, yung landing page nila, and you can see an entire roster of other topics that might be of interest to you. And it doesn't end with just skincare. Ayan, as you can see here, asthma, as we mentioned before, influenza, urine glucose tests, among many other topics. So, pagdating sa medical information, we have hellodoctor.com.ph. Pagdating naman sa health services, you have Alaga Health. So, kumbaga combo package right there. And that's all for Alagang Hello Doctor for the evening. So, let's jump right back into it, no? Since nakita natin kanina, Doc Iza, yung term na glutathione, and probably not just that, but all the other quote-unquote miracle beauty skincare products that are available on Shopee, Lazada, among many others. Sinasabi nila na pag pinahid mo daw ito, automatic mawawala yung pores mo. Magiging Koreano ka na at titingkad yung balat mo. What is the ultimate skincare routine and what are the products that you actually recommend as dermatologists? Kasi kumbaga, there are a lot of viewers right now that have been asking, even in our inbox, sana i-discuss nila, Doc, kung ano nga ba yung ultimate skincare routine na approved ng dermatologist. So, kita-kita naman natin, Doc Iza, anong thoughts niyo dito?
Thank you, Dexter. Thank you sa mga nagtanong. How I wish na merong isa lang na pwedeng i-take or pwedeng ipahit sa balat na boom, magic na. How I wish. Ako mauunang makabili nun. Pero sa ngayon, wala talaga. At saka hindi lahat nag-work. Kung ano yung nag-work sa isang tao, pwedeng hindi mag-work sa another patient. So, dapat tailored talaga sa'yo. So, kung magkokonsulta ka sa yung dermatologist, ang unang tatanong sa'yo kung anong type ka ng skin mo. Oily, combination, dry, nasa dark end ka ba? May mga skin types kasi tayo yung light, yung medyo morena. So, iba-iba yung treatment. Kahit sa dark spots, sa pimples, iba-iba rin yung treatment. Wala akong may isang drug na pwedeng mai-recommenda sa ngayon. Pero in general, kung kasabi ni Doc Kei, number one talaga sunscreen use, at saka kung anti-aging man, meron tayong tinatawag na retinoids or tretinoin. Mas ma-explain yun ng inyong dermatologist. Yes, the sunscreen talaga. Ano pa ba, Doc Kei?
Doc Kei, so I think makakatulong dito si Doc Kei kasi actually Doc Kei also has a page. Same as Doc Iza, you can actually follow them on Facebook and it's actually streaming on their pages now. Si Doc Kei, ito, ang ganda kasi he has his own Facebook page. Plus, I believe he has a TikTok wherein you can learn more about healthcare and skincare tips. Kutis by Kei. Yeah, plug natin yan, Doc. So, additional thoughts daw sa sinabi ni Doc Iza, Doc Kei.
Yes, so thank you for plugging. So, yon, follow me on TikTok, Kutis by Kei. So, gumagawa ako ng maraming stuff regarding skincare, no? So, summarize ko lang yung basic points, no? So, una, of course, you need to cleanse, no? Nagugulat ako sometimes may mga taong hindi naghihilamos, no? So, of course, you need to cleanse pagkagising and bago matulog. So, at least twice a day, no? The best cleanser, wala, no? Pero if you have oily skin, I would recommend a foaming cleanser. So foaming, meaning bumubula siya, no? So marami namang foaming cleanser available in the market. Bakit foaming? Kasi dahil bumubula siya, tatanggalin niya yung excess sebum from your skin, no? Which is good for oily skin. If you have dry skin naman, I recommend a gentle cleanser lang, no? So it doesn't need to be foaming. Hindi kasi ako pwede mag-drop ng brands dito, no? So basta any gentle cleanser. Do not use soap for your face, no? Kasi soap is very harsh, no? So always invest in a good cleanser. So that's tip number 1. Sa umaga, depending on your skin concern, no, you can apply a treatment product, no? So that's usually step 2. So maraming treatment products, no? So for example, if ang concern mo is dark spots, you can use vitamin C, niacinamide, marami, no? It's better to talk to your dermatologist to go in more detail, no? And then sa umaga, number 3, yun nga, yung sinasabi namin ni Doc Iza, no? We can't emphasize this enough. So wag na wag kakalimutan mag-sunscreen, no? Kasi the earlier you use sunscreen, no, the later natatanda ka. So promise yan, no? So always use sunscreen. Nasa loob man, nasa labas, anywhere, kahit saan ka, use a sunscreen. Tapos sa gabi, no, Doc Iza already mentioned it, I always recommend a retinoid product, no? So marami kasing retinoids. Some are prescription, which is the tretinoin, no? Some naman are over-the-counter, like yung mga retinol or retinaldehyde, no? So invest in a good tretinoin or retinol product kasi it's the most studied ingredient when it comes to skincare, no? Aside from anti-acne, it's also anti-aging and it also brightens the skin, no? So, ayun, the earlier you also use the tretinoin products, the later natatanda ka. So, yun. Kung may takeaway kayo from this, use sunscreen in the morning, use retinoid in the evening. So, that's the very most simple way I can explain it kasi alam ko wala naman tayong time. So, ayun. Thank you.
Yeah, actually, feeling ko marami na nagdo-notes kasi yung iba kung ano-ano daw yung ginalagay nila sa mukha, kulang ng yelo at iba-iba pang bagay para lang daw lumiit ang kanilang mga pores at maging next K-pop idols. Kaya talagang skincare talaga one of the most requested topics sa Alaga Health. So, actually, we're actually nearing the end of our show. So with that being said, I think it might be time for our Alaga Health wrap-up. There you go, Alaga Health wrap-up. So, I think we've talked about so many things tonight, from mental health to skincare, psoriasis, given a particular emphasis. Siguro, maybe it's time for final words or maybe final tips for our viewers, especially when it comes to skincare, our advocacies, mental health, among many others. So, maybe it might be great to start it off with our patient champion for the evening, none other than Psoriasis Philippines' Sir Paul Mendoza. Anything to plug, an upcoming event, or probably something that you would like to invite all of our viewers to, Sir Paul?
Yeah, so far siguro if there's may nanonood sa atin na psoriasis patient or may kakilala kayo na merong psoriasis, we have this Coach program. So you can register, just type sorcoach.sorfil.org. It's a free service where we will provide you your personal coach to help explain ano yung psoriasis, what are the do's and don'ts, and to guide you in your psoriasis journey.
Yon. Thank you very much, Sir Paul. As you can see, no, Sorfil is actually a group of champions of the advocacy regarding psoriasis care, and they don't just gather to, kumbaga, share experiences, but also to assist others, to link them to services, and to guide them throughout the entire process. Ang ganda nga daw ng community, as mentioned by Doc Iza and Doc Kei. So, maybe we can jump to Doc Via. Any final thoughts? Particularly, as you can see, we cut across pagdating sa primary care, and how do we link all of our patients, mapa mental health, mapa skincare, mapa anything under the sun. Any final thoughts, Doc Via?
Yes, Doc Dex. I'm pretty sure a lot of our viewers have learned a lot in this segment, no? Ako mismo, ang dami ko natututunan, no? Ang dami ko natutunan about skincare, about how you actually take care of your skin, no? And one of the things I would like to leave our viewers for tonight is that don't hesitate to ask. No, wag pong mahiyang magtanong sa ating mga specialist, ating mga eksperto sa anumang karamdaman, no, na ating nararanasan. May it be a skin problem. No, we have our lovely dermatologist, si Doc Iza and Doc Kei, who is willing to take care of your skin, no, to make you feel not only good about yourself but actually healthier, no, because everything starts with how you feel on the outside, no, and of course we have to also look into how we feel on the inside, no. Nandyan si Doc Joan to always, no, help us guide through how our experiences would play in how we would take care of ourselves. And of course, we have our champions, and nandiyan sila Sir Paul, no, who's willing and ready to assist us with whatever we need with our advocacies, no. And of course, nandiyan yung Alaga Health para alagaan ka sa inyong mga health problems, no. And with our partners, Hello Doctors and Quarantalk, we are always here to be ready to assist, no. And wag pong mahiyang magtanong. Pangalagaan po natin ang ating sarili, and we will see you next week.
Perfect. Thank you for that, Doc Via. No? Always reach out to your health professional of choice para sigurado na kayo ay nagagabayan sa inyong mga healthcare concerns. And tama yung sinabi niya, healthiness is something that is seen both outside and inside. And speaking of which, pagdating sa ating taking care of our mental health and internal well-being, maybe we can ask for her final words, Doc Joan Perez-Rifareal.
Yes, again, maraming salamat Alaga Health for inviting me once again. And of course, ako lang just to remind everyone na talagang let's always remember na in any medical condition, lagi pong merong mental health po na component kasi always po holistic ang tingin natin, no? Hindi lang siya compartmentalized lang sa skin, sa kung ano man, no, na medical problems, but always kasama lagi ang mental health because we always follow the biopsychosocial approach in the management of medical and mental health concerns. So, kaya always siya holistic and it's really a team effort. Kaya maganda na ganito ang ating no, na may always siya collaboration always between the doctors also and the other specializations, and of course, collaboration with the patients and the family. So, maraming salamat po, and always remember that you are never alone. Help is available, and huwag pong mawala ng pag-asa kasi definitely po kahit mental health conditions like depression na concern kanina na ni-raise and other skin problems, there is always help available, and maganda po ang recovery rates natin. So thank you very much, Alaga Health.
Thank you very much, Doc Joan. And of course, ang ating mga special guests for this evening, our dermatologists. Probably final tips, probably maybe final skincare routine advice for our viewers, and probably you can invite them to like and share your page. Maybe we can start with Doc Kei, Kutis by Kei.
Hello everyone. So thank you so much for inviting us. No, so kulang na kulang yung time. Maybe another separate segment on skincare lang. No, even that itself, kahit 2 hours tayo mag-usap, pwede. No, so please like my page on Facebook, Kutis by Kei, also on TikTok and IG. So if you have any concerns, you can talk to me. My final tip, don't self-medicate. No, napapansin ko sa ating mga Filipinos, mahilig tayong magpahid ng kung ano-ano, no? So, even with skincare, mahilig tayong gumamit ng sobrang daming products. Basta nakita natin sa Shopee sale, sa Lazada, no? Buy agad. Tapos, lalagay natin sa face natin. Ang dami ko nang naging patients, no? Ang dami-dami nilang nilalagay. And sa sobrang dami nilang nilagay, no? Imbis na ma-solve yung problem nila, lumala pa lalo, no? So, when you have a skin problem, always talk to your board-certified dermatologist muna, no? Kasi yung investment, yung money na pinambili mo sa Shopee, add to cart ng kung ano-anong skincare products, sana in-invest mo na lang sa talking to your dermatologist, who could guide you more, no? Rather than yung mga self-medicating, no? So, yun yung number 1 tip ko for tonight. So, thank you for inviting me.
All right, once again, that's Doc Kei Rebolledo, and you can follow him on Kutis by Kei. Ang gaganda ng mga TikTok videos ni Doc. Sobrang fun to watch. May matututunan ka na, plus na-entertain ka pa. To rundown of guests this evening, let's call on Doc Iza Encarnacion. Yes.
Okay, hello.
Go, Doc Iza.
Okay, hi. Nasabi na nilang lahat. Actually, it's always best kung magiging kung parang collaboration nga. So, I really applaud and I really commend the Alaga Health for doing this for reviewers, for the Filipino community. This is very rare. This is the first time na I've been invited to something like this, and proud talaga na meron tayong ganito. Sabi nga nila, magkaka-connect lahat ng organ systems natin. So, whatever is happening inside, sometimes it manifests sa skin mo. So, yung sinasabi nila, skin is like a window to what's happening inside your body. So, it's always best not to just, take care of the outside, but also of the inside, and consult your dermatologist for what's happening outside there, so we can better help you, we can better provide solutions for your skin concerns and how to better take care of your skin. So that's all. Thank you.
There you have it. Thank you sa ating mga special guest doctors this evening. We have celebrity doctors, we have medical specialists, we have patient champions. Nako, lahat po yan dito lang po sa Alaga Health Live. And we thank you for joining us tonight. And look at the time, ang bilis talaga ng panahon when you are learning and hopefully having fun, learning more about skincare, mental health, and so much more. So, kita-kita po tayo ulit sa susunod na Sabado para na naman po sa isang oras ng libreng konsultasyon at masayang kwentuhan with our partners and friends dito lamang po sa Alaga Health Live. And next week, nako, pamilyang Pilipino po ang bida dahil ipagdiriwang po natin ang World Population Day. Yan, World Population Day. At muli, ako po si Doc Dexter Galban na nagpapaalalang alagaan ng kalusugan para umunlad ang ating bayan. Muli, ito po ang Alaga Health Live. Magandang gabi po. Thank you, everyone.